So today I'm going to be giving a speech about cancer. So we're just going to be going over the basics of cancer today. So today we're going to be over how cancer is formed, how it is treated, and then how cancer can be prevented. So in case you're ever scared of getting cancer or anything, you know how to prevent it in a couple different ways. So the first one we have is how cancer is formed, and first we have genetics. So genetics are something that you get from your parents, so it's passed down kind of like heirloom or something, but it kind of defines who you are. So genetics would be like your hair color, your eye color, skin color, things like that. And so cancer is formed in them when there's a mutation in the genes that makes them cancerous, so they just don't perform properly. And then carcinogens can also affect the DNA. So carcinogens are just bad chemicals that you can encounter every so often, and so they will affect the DNA. And then carcinogens lead into my next topic of how it's formed, which is your lifestyle. So carcinogens are usually caused because of your lifestyle, the chemicals you're working around, your job, things of that nature. A lot of factors lead to cancer in your life, but if you're safe, you can avoid them. And if you're well educated about cancer and how to prevent it, so that includes smoking, dieting, exercise. The sunlight can actually hurt you, which is ultraviolet rays. A lot of people don't know that, so just wear sunscreen, be safe. And then some infections can even give you cancer, so make sure that if you get a cut or something, you clean it, properly wrap it and everything. So a lot of these things are just there are things that you can easily avoid. And then the third way you could get cancer is just from your cells. So when that happens, the cells multiply too quickly, and you begin to not have old or damaged cells be taken away or destroyed. So you have old or damaged cells, but your body's still making new cells. It's producing new cells. So you get too many, and then when you have too many, these form growths under your skin or in your brain called tumors. And then so tumors can be non-cancerous and cancerous. And so when they're non-cancerous, they're called benign tumors, which means if you remove it, that's not likely to grow back. You've gotten rid of the non-cancerous tumor in your body. But the cancerous ones are called malignant, and those have a chance, if you get them removed or have them treated, that they can come back. And sadly, sometimes they do, and that's just not really good for the people who are involved with that. And then so this leads to my next, how cancer is treated. So there's a couple main ways on how cancer is treated. So the first one is surgery. So in surgery, they will surgically remove the tumor. They will cut open your skin, and they will just take it out of the skin. So they can remove the entire tumor all at once. So they'll just cut it open, take the whole thing out. They can debulk the tumor, which is just taking some parts of it off, and that usually happens if it's around an important organ or it's just near too many vessels. So like if you have a tumor near your heart, in your brain, in your lungs, something like that, they'll usually just debulk it. And then the third one is they will remove the tumor that's causing pain. So it's not necessarily going to help you have your cancer treated, but it's going to numb the pain a little bit, so you're not going to feel as bad. The next one is radiation. So how radiation is used, they use high doses to kill the cancer that is formed inside of your body. And then so how that works is it damages the cancer's DNA. And so radiation doesn't work right away like surgery would. It could take days or even weeks to actually see effects of the radiation. So you just kind of have to stick with it. And there's two types of radiation. There's external beam radiation therapy, and there's internal radiation therapy. So external beam radiation therapy it's from a machine that you're outside of, and it aims a beam right at your tumor, your cancerous spot. So say you have a tumor like in your shoulder, the machine would point right to it. And then so this is local, so it'll just like I said, it'll be the one part of the body. It won't spread throughout the body. You'll only get the radiation to the one spot where the cancer is. That's usually if you only have a one tumor. And then there's internal radiation therapy, which is if you have it throughout your body, or you have a type of cancer that's in your blood or something, like leukemia, which is blood cancer. And so a source is put inside of your body, and so it could be a liquid or a solid, and it will travel through your entire body. So the solids include seeds, ribbons, and capsules that are placed into the body or near the tumor inside your body. And then so the solids are called brachytherapy, so it's a new term for a lot of you. And then liquid is the systemic therapy, and so that'll travel through the blood and go through your entire body and kill the cancer cells. So you could either swallow the liquid, which would be in your stomach and get digested into the bloodstream, or you just get it straight into your vein through an IV, which is a much more direct route. So the third type is chemotherapy. So chemotherapy is just when you use drugs to kill the cancer cells, but sometimes it's just used to stop or slow the cell's reproduction, and so it can shrink the tumors, causing the pain, and it's used with other treatments. So this can be used with surgery and radiation. So when it's used to make tumors smaller before the surgery or radiation therapy, it's called neoadjuvant therapy. So that's just when they make it smaller so it's easier to take out of your body for surgery, or if it's just so the radiation will affect it more. And then the other way that they can use it before with other treatments is it can destroy the cells after the surgery or the radiation, so that's called adjuvant chemotherapy. So that's if you have radiation treatment or you have a surgery and there's still some cancer cells, they can use chemotherapy to try to successfully get rid of the other ones. And then so the third way that you can use it is if it kills the cancer cells that have returned to the body. So that's if you have gotten treated before and cancer has come back, they might use chemotherapy first to just try to get rid of it. So you're just taking drugs and you're not going through surgery, which can be painful, or radiation, which could also hurt your body. And then so lastly, we have how to prevent cancer. So the first one is just dieting. You just got to eat healthy, exercise, and you got to make sure you know what's going in your body. So that just, like I said, eating healthy, make sure you're not eating too much bad food, and make sure you're not smoking. Tobacco is actually very bad for your body. A lot of people know that, but still just stay away from tobacco, and even secondhand smoke can cause cancer. And so the second one is chemo prevention. So this is when you take medicines to treat precancerous conditions, or you can keep the cancer from starting, which is a really good thing because then you can help yourself not get cancer. And then so the third one is precancerous diseases. So these are diseases that are able to turn into cancer in the long run, and so those aren't very good. So you need to make sure you're taking medicine. You have to visit your doctor regularly. If you find something irregular with the body, like a hard lump or something, make sure, go get it checked out, make sure it's not a tumor, or make sure it's a benign tumor, not malignant, so you're not at risk of having cancer. And make sure you find them early. And then so, in conclusion, today I've talked to you guys about how cancer is formed, how cancer is treated, and how cancer can be prevented. So hopefully you learned something from my speech today. Have a nice rest of your day.